Today we shall discuss our lecture about non-communicable diseases. They are a group of diseases that vary than communicable one. They are diseases other than the infectious and the parasitic ones. So they are non-transmissible, but restricted to involved cases. As we know, any disease which has no specific etiology is known as a disease of multifactorial etiology. So, non-communicable disease, the etiology of which is that not yet determined for some diseases, as malignancy and essential hypertension, while others are caused by a big variety of etiologic agents. So, in order to prevent non-communicable diseases, it is very important to understand what's meant by risk or predisposing factor for each disease. The most four main types of non-communicable diseases are cardiovascular diseases, diabetes mellitus, chronic respiratory diseases, of prime of which is bronchial asthma, and finally cancers. By risk factors are not causal agents, but factors or events associated with more susceptibility and or increase the incidence of the disease. Some facts about non-communicable diseases. Cardiovascular diseases account for most non-communicable deaths, about 17.7 million yearly, followed by cancers, followed by respiratory diseases, about 3.9 million, and finally diabetes, that account for 1.6 million. Non-communicable diseases are largely preventable by means of effective interventions that tackle shared risk factors. We shall discuss two important subjects. The first is hypertension, and the second is coronary artery disease. Hypertension, the maximal normal blood pressure levels beyond which the individual is considered hypertensive, are adults at rest 150 per 90 millimercury, while during the pregnancy it is about 140 per 90 millimercury. Etiology of hypertension. Hypertension is broadly classified into two types: essential hypertension and secondary hypertension. Essential hypertension, or primary one, constitute about 90 to 95% of hypertensive cases. Essential hypertension, no particular cause can be accused for it. It is idiopathic. So it is a disease of multifactorial etiology. So risk factors must be of prime importance. Some risk factors related to increase the output of the heart or increase the peripheral vascular resistance have been suggested. The first risk factor is the genetic factor. It is reported in some families in which some genetic defects will influence the arteries. Second risk factor is common salt. A sodium chloride content of the diet may play a role. Thirdly, obesity is a risk factor for essential hypertension, although it is not certain. Fourthly, alcohol, where regular alcohol consumption elevates blood pressure. Lastly, other potential risk factors including worry and anxiety and psychological disorders. The second type of hypertension is secondary hypertension. Some pathological conditions are associated with hypertension, the most important of which, renal hypertension, accounts for the majority, around 80% of secondary hypertension. Underlying renal diseases may be chronic glomerulonephritis, pyelonephritis, renal artery stenosis, and collagen disease. The second type of hypertension is endocrinal hypertension, which is related to suprarenal and pituitary, in addition to contraceptive pills that contain estrogen. The third type of secondary hypertension is hypertensive disease of pregnancy, which is known as toxemia of pregnancy. The fourth variety of secondary hypertension is coarctation of aorta. The final type of secondary hypertension is collagen disease, particularly when kidney and the vessels are involved. Risk factors for hypertension. Some risk factors are proposed. They include age, sex, familial tendency, body build, and lifestyle. Firstly, age of onset varies. Essential hypertension is usually found in the age groups between 25 up to 55 years. Secondary hypertension may occur at any age. 6. Females are usually more affected, especially over 40 years. Yet, they are less exposed to the risk of complication. Regarding familial tendency, more than one family member may show essential hypertension. Regarding body build, obese may show higher incidence of cardiovascular diseases, including hypertension. Lifestyle, very, very important risk factor in essential hypertension, particularly busy, noisy, sophisticated urban life that may show somewhat higher blood pressure than the calm, monotonous rural life. Also, anxiety, emotional reaction, and the physical exertion may cause little elevation of blood pressure in normotensive and a marked increase in hypertension. At the end, cigarette smoking, alcohol consumption, and uncontrolled dietary fat, besides common salt and sugar, are risk factors for hypertension. Prevention of hypertension. For essential hypertension, it is based on avoidance of risk factors as weight reduction, quit smoking and alcohol, dietary sodium restriction, and increased physical activity. For secondary hypertension, it is based on prevention and control of etiology, especially renal disease. Preventive measures in general are healthful lifestyle related to diet, physical activity, and exercise, in addition to health hazards of smoking and alcohol. Risk factors of essential hypertension and the etiology of secondary hypertension. Secondary, prevention and control of the etiologic factor of secondary hypertension, based on community development and sanitary environment. Control through screening for early case finding, especially among high-risk groups. Secondly, early diagnosis and the proper medical treatment. Lastly, patient education for compliance on treatment and the periodic checkup. The second important subject is coronary heart disease or ischemic heart disease. Very, very important subject in non-communicable diseases. It arises when blood supply of the heart muscle is impaired, either partly or completely. It is the most important leading cause of death in Egypt. Causes of myocardial ischemia. Two causes. The first cause is interference with blood flow in the coronary artery through narrowing or obstruction of one or more of the branches of the coronary artery. It is the major cause of myocardial ischemia and ischemic heart disease. Two factors contribute to ischemia of myocardium. The first is decreased flow of oxygen, ending by diminished hemoglobin, carried oxygen, and hypotension. The second is increased oxygen requirement of myocardium, leading to hypertrophied myocardium and decreased output of the heart. Etiology of impaired coronary blood flow, the most important are coronary atherosclerosis, very, very important, thrombosis, and spasm. In addition to coronary embolism and dissecting aneurysm. Non-pathological risk factors for coronary heart disease. Very, very important in ultra-short question of exam. They are divided into unmodifiable risk factors, A, and B, modifiable risk factors. The unmodifiable risk factors include age, race, sex, familial tendency, in addition to personal type. First, age. The atherosclerotic process progresses with age, as we know. So the incidence of coronary heart disease increases with age, and is commonly a problem of the second half of life, I mean after the age of 40. The second unmodifiable risk factor is the sex. Premenopausal women, the incidence is quite lower than comparable males. Male to female ratio may reach up to 10:1. It is attributed to uncontrolled oral contraception. That's a risk factor for hypertension ending with ischemic heart disease. While after menopause, the incidence of atherosclerosis and the coronary heart disease sharply increases. The third unmodifiable risk factor, race. The incidence of coronary heart disease shows racial variation, which may not be true racial, but attributed to varied dietary habits and lifestyle. The fourth unmodifiable risk factor is familial tendency, where familial proneness, I mean several family members involved, may be explained by genetically related and common dietary and lifestyle factors. The fifth unmodifiable risk factor is the personal type. It is considered a minor risk factor, where type A personality, characterized by possessing aggressive, compulsive, and competitive individuals, is more exposed to the risk of coronary heart disease, twice as type B. Non-pathological risk factors also include the second category, which is very, very important in ultra-short questions of the exam. Modifiable risk factors for coronary heart disease include diet, physical inactivity, cigarette smoking, high alcohol consumption, mental stress and worry, uncontrolled oral contraception, and social living. The first one, diet, may be a risk factor through triad mechanism, whether obesity, through diet, secondly, dietary fat, thirdly, dietary carbohydrate. Obesity, a risk factor of diabetes and hypertension for both. Otherwise, it is not certain. It is a risk per se. Secondly, dietary fat, particularly saturated fat-rich diet. Thirdly, dietary carbohydrate, through consumption of excessive carbohydrates with excess refined sugar rather than complex carbohydrate from grains. The second modifiable risk factor is physical inactivity. We know that activity and regular exercise contribute to physical fitness, الرشاقة, and the body weight control, with lowering susceptibility to coronary heart disease and vice versa. The third modifiable risk factor is cigarette smoking, proved to be associated with significantly more incidence of coronary heart disease according to daily number of smoked cigarettes, duration of smoking, and whether started at young age. On giving up smoking, the risk declines to reach the non-smoking level after around 10 years. The fourth non-modifiable risk factor is high alcohol consumption, which is associated with increased risk of hypertension and coronary heart disease. The fifth modifiable risk factor is mental stress and worry. Professionals, businessmen who may be continually exposed to psychological stress and tension are from a high risk group of coronary heart disease. Uncontrolled oral contraception. Oral contraception are always associated with a higher incidence of hypertension and coronary heart disease. The last modifiable risk factor is social living, where varied incidence of coronary heart diseases among different social groups within the same community, and it is attributed to associated variation of lifestyle. Pathological risk factors for coronary heart disease, very important. Hypertension, diabetes mellitus, obesity, and hyperlipidemia. Hypertension increases the risk of coronary obstruction, which leads to increased morbidity and mortality of coronary heart disease. Diabetes mellitus, where hyperglycemia and preclinical diabetes with impaired glucose tolerance are major contributing causes of artery disease, including coronary atheroma with increased risk of coronary heart disease, obesity per se is not correlated with coronary heart disease. However, role is indirect when associated with hypertension, hyperlipidemia, or hyperglycemia. The last pathological risk factor is hyperlipidemia. Chronic heart disease is a problem of high serum cholesterol. The risk of hypercholesterolemia is aggravated by low level of high density lipoprotein. Other minor factors for coronary heart diseases. Some minor factors may be associated with increased risk of coronary atherosclerosis as gout, prolonged consumption of soft water, in addition to hyperuricemia that may be a risk factor. So prevention of coronary heart disease, it could be attained through the management of risk factors. Control of coronary heart disease will be subdivided in 3 categories: case finding, dietary therapy, and monitoring blood cholesterol. Case finding that can be done through availability of wide comprehensive medical and laboratory services, in addition to health consciousness of the public, particularly among high-risk groups. Secondary, dietary therapy that must be combined with drug therapy. Lastly, monitoring blood cholesterol and low-density lipoprotein. Thanks.